On the afternoon of Wednesday, May 8th, 2024, Montgomery County Fire and Rescue crews from Station 3 and Station 21 were dispatched to a residence in Rockville for the report of a patient in cardiac arrest. As MCFRS crews arrived, they found the patient lying unconscious on the floor and his sister performing chest compressions on him. The patient's sister stated that she found the patient to be unresponsive upon her return home and had immediately called 911 for assistance. The 911 call was answered by Public Safety Emergency Communications Specialist Christian Moe dispatcher. Christian was able to remain calm and coach the patient's sister through performing chest compressions. Moe dispatcher remained on the line with the patient's sister until the arrival of MCFRS crews. MCFRS crews performed a quick assessment and found the patient to be pulseless and apneic. The crews initiated high-performance CPR, ventilated with a bag valve mask, and placed the patient on the cardiac monitor. The initial rhythm was ventricular fibrillation. The patient was defibrillated and chest compressions were continued. The crews obtained vascular access with an IO and epinephrine was administered. At the second and third pulse checks, the patient remained in ventricular fibrillation, so the patient was defibrillated twice more, and amiodarone and additional doses of epinephrine were administered. The patient's airway was secured with an advanced airway, and end tidal was monitored. At the fourth and fifth pulse check, the patient remained in ventricular fibrillation, so vector change was performed, and the patient was defibrillated twice more. 18 minutes after the 911 call, at the sixth pulse check, the patient was found to have return of spontaneous circulation with an organized sinus rhythm and strong radial pulse. The crews obtained a 12-lead EKG and vitals, as well as packaged the patient for transport to Suburban Hospital. En route to the hospital, the crews continued to monitor vitals and noted that the patient had become hypotensive. A second vascular access site was established, and an epinephrine infusion was initiated to stabilize the blood pressure. The patient began to have spontaneous respirations, but still required assistance via bag valve mask ventilations. Upon arrival to Suburban Hospital, patient care was transferred to waiting emergency department staff. The staff worked to stabilize the patient, and he was transferred to the intensive care unit, where his condition continued to improve. The chain of survival is integral in increasing the patient's chance of survival in the event of sudden cardiac arrest. Thanks to the quick activation of 911, the excellent communication from Christian Moe dispatcher, early bystander CPR, the knowledge and skills of the MCFRS crews on the scene, and the excellent care from the staff at Suburban Hospital, the patient was discharged home neurologically intact on May 24th, 2024. Montgomery County Fire and Rescue Service is proud to recognize the personnel for their dedication, professionalism, and teamwork.